what I want to talk about is why the idea of writing handwritten thank you notes to your patients can be a very useful practice builder. Handwritten thank you notes. Okay. Now, some of you got to be rolling your eyes, like saying, "What did Gary wake up in the 1960s?" No, I'm talking about doing this today. All right, let me make my case. So, first of all, handwritten thank you notes were a fixture in our culture and our society for many, many, many years. Would you agree, Naren?
Yes, I remember it was very common even in the 80s and perhaps even in the 90s to some level. But I think it just went away in the 2000s.
Oh, it completely went away. It went away when, emails became, a dominant form of communication. So email evolution took a big bite out of it. And then I think the next thing that kind of did it in was text messaging.
Yes.
Because why would you write a thank you note when you can just text them immediately? Okay.
Yeah, exactly.
So here, let me make my case for this. And again, just stick with me on this. And before I make my case for it, let me explain how this fits into our topic of becoming less insurance dependent. It fits into your topic because the stronger your practice is, the more you have patients who are not just patients of yours, but they are your loyal champions, the more successful you're going to be reducing insurance dependence. Because when you have a practice full of loyal champions, they will not go anywhere else.
100%.
They're like granite. They're like the rock of Gibraltar in your practice. It would take a herd of wild horses to get them to consider even going somewhere else.
Absolutely.
Versus a patient that is kind of neutral in your practice. The patient that's kind of neutral, they'll go down the street to an office that's in network. So part of the strategy is building a bigger base of loyal champion patients in your practice. So here's the project. Let's break it down into something very practical. And just stick with me on this, doctors. Doctors, I would like you to create a goal in your practice to send out 4 or 5 handwritten thank you notes every day to the patients that you saw that day. 4 or 5 handwritten thank you notes. On a given day, it depends how many doctors you have in your practice, how many hygiene patients you have. So it's hard to give an estimate of the number of patients you see on a daily basis. But let's say you're a solo doctor with a nice strong schedule. And let's say you've got a couple of hygienists and they've got a nice strong schedule. On a given day, you might see 30 patients a day. Would it be hard to pick 4 or 5 that we could write a handwritten thank you note to? And of course, if you have a bigger practice, there could be many more opportunities to do that. But I think if we sent 4 or 5 out over time, that'll create a wonderful effect on your practice.